Are you curious about oral hygiene while you have braces on? Dr. Khedkar is going to tell you everything you need to know on the next episode of the Charles River Orthodontics podcast. Stay tuned. Dr. Khedkar, how is oral hygiene especially important for people with braces?
So, proper and consistent oral hygiene is really important for everyone. But when you have braces and wires in your mouth, there's really more areas where food and plaque can accumulate. And when it accumulates and it's not being cleaned off, it can definitely lead to more severe consequences that can occur in a shorter time. So, really, the main thing is that oral hygiene with braces does take a little bit longer because you want to make sure that you're cleaning all surfaces of the appliances. And so that's really the main difference. But again, it's important for everyone. It just takes a little bit more longer and it's a little bit more involved when you have braces on your teeth.
So, how often should someone with braces brush their teeth?
I instruct my patients to brush at least 3 times a day. So usually I tell them to brush after dinner, after breakfast in the morning, in the middle of the day after lunch, and then also right before bedtime. I know some kids don't have enough time to brush after lunch, like at school, if they have to get to the next class. So usually what I recommend in those cases is at least just take a sip of water and swish it around, rinse if you can, and then brush as soon as you get home from school. And then every time you're brushing, you should be brushing for at least 2 to 2.5 minutes, because anything less than that, you're not really cleaning every surface of your appliances and your teeth. What I usually recommend for people is to get either a timer in the beginning or a song that lasts that long, because sometimes you'll be brushing and it feels like 2.5 minutes have passed and it's really only 30 seconds. So that's really a good way to make sure that you're brushing for as long as you need to.
So, is there a particular toothbrush that's best for someone with braces?
There really isn't a particular toothbrush. You can use either a mechanical or an electric toothbrush. The most important thing is that you're using soft bristles and that you're angling the toothbrush properly. So whether you're using a mechanical or an electrical, you have to make sure that you're angling the toothbrush so that you're cleaning above the braces, below the braces, also underneath the wire, and along your gum line. So that can really be achieved with any type of toothbrush. The main difference is that with the electrical toothbrush, it does usually perform the small circles for you, while with the mechanical, you're kind of using your hand to make the small circles. And then sometimes electric toothbrushes have a timer built in, which can be helpful for making sure you're brushing as long as you need to.
Are there any other special techniques for brushing when you have braces on?
Really, the main technique is just mastering the angling of the toothbrush. So, as long as you are consistent with angling the toothbrush in all the different angles on all surfaces of the teeth and making sure you're brushing for a long enough amount of time, that's really all you need to do to be able to clean all surfaces of the braces.
Ah, so how about flossing with braces? I know that's a little different, right?
So, flossing is very important for anyone with or without braces, but with braces, it does take a little bit more time and effort because the wires are there. And so the wires can get in the way of how you would normally floss. So, with flossing, usually there's a couple of different things that you can use to help with the flossing. So, we would recommend either using a floss pick. So, those are the little ones that are on the stick. You just have to make sure you have to get the ones that are specifically for braces. If you use the ones that are just for teeth, they won't fit behind the wire. You can also use floss threaders, which is just like a little plastic tool that helps you to guide the floss behind the wire. I do also want to point out, and I always tell this to everybody, is that flossing is really the only way that you can remove all of the plaque and food from between your teeth. You know, sometimes you'll see on water picks, they'll call it a water flosser and say it can take the place of flossing, and that's just not the case. It can be something to use in addition, but it won't take the place of regular flossing.
That's interesting because I've heard differing opinions about that. I'm glad that you set the people straight on that. How often should someone floss if they have braces?
Ideally, you should floss every time you're brushing, so about 3 times a day, but we understand that it's pretty time consuming. So what I tell patients is, if it's a time issue, just make sure you're at least flossing once a day. The best time to do that is at night because you want to make sure you're removing any of the buildup that happened throughout the day. So what I tell people is you should set aside at least 10 minutes for your oral hygiene routine at night before bed so you can make sure you're flossing and also brushing properly.
Ah. So what role does mouthwash play in all of this?
Mouthwash can be helpful in removing some larger pieces of debris or freshening your breath, but it's not absolutely necessary. So, as long as you're flossing and brushing properly, mouthwash is just an additional thing that's really not absolutely necessary to your oral hygiene routine. The only exceptions to that are prescription mouthwashes that you may be prescribed by your dentist. So, those would be used to help with infections, dry mouth, or some other issues in your mouth that's happening at the same time.
Are there any types of mouthwash you recommend or you think people should stay away from?
The only thing I recommend is that you stay away from mouthwashes with alcohol in it. So those are the ones that burn when you're swishing them around. It used to be that they said when you feel the burn, that means it's working. But actually, what's happening with that burn from the alcohol, it's actually desiccating or drying out some of your soft tissues, and it can make dry mouth worse. It can also sometimes wipe away some of the good bacteria that's in your mouth. So we want to take away the bad bacteria, but we don't also want to affect the good bacteria. So if you're using a mouthwash without alcohol, that's really better at achieving that balance of cleaning out the things we want to get rid of, but not affecting the good bacteria in the mouth.
Okay. So are there any foods that you should avoid when you have braces?
Ideally, you should avoid anything very sugary or very acidic, especially sodas. Sodas, in general, you want to stay away from. But if you do have a sugary item, you want to just make sure that you're cleaning your teeth well afterwards. You don't want that sugar to sit on your teeth long term because that's when really the plaque can start to accumulate. Other foods that you should avoid with braces is anything that can stick to your braces or cause them to break off of the teeth. So that would include gum, sticky or hard candy, caramels, or really anything that's very hard and crunchy.
Okay, so what if you're eating out, you're away from home, and you need to clean your teeth? What can you do?
What I recommend is always having a travel toothbrush and a small floss with you. So you can get those travel toothbrushes which fold up to a pretty small size and just like a mini floss to take with you. That way you can keep it in your pocket, you can keep it in your bag. But the last thing you want to do is be eating out and then you have food stuck in your braces and you really have no way to clean it off. So it's helpful if you have that little travel kit with you so you can just run to the bathroom and take care of it.
Are there any signs that you should be aware of if your braces are not cleaned properly, like showing you that they're not being cleaned?
Sure. So, the main sign is that when we have a patient come in, if we see that there's plaque built up on the braces. So it's not just food, it's plaque, which is that kind of white filmy substance that forms over time. And we can tell if it's plaque that's been sitting there for a long time or if it's just from food that was eaten recently. So when you have plaque that builds up on the teeth, what can happen is it can create an infection in your gums. So we'll see that the gums are very red, inflamed, that they're bleeding easily. It can also start to cause something called decalcifications on your teeth. They're also called white spots. So what happens is when the plaque is sitting on your teeth for a long amount of time, the acidic nature of the plaque will start to eat away at some of the minerals in your teeth and will create these white spots on the front of your teeth. And those don't go away. They're basically early cavities. So what would happen with white spots is when you're finished, you'd have, straight teeth and a great bite, but you could end up with white spots. So we want to avoid that. You can also see cavities sometimes when it's been left a very long time. So those are really the main things that we're looking for whenever someone comes in for an orthodontic check.
Now that makes sense. So how often should someone come see your dentist or orthodontist?
So when you have braces, we usually see the patient for adjustments every 4 to 6 weeks. During those visits, we'll be adjusting the wires or adjusting the braces. But it's very important that they're also seeing their general dentist at least every 6 months for an exam and cleaning, because at that time they'll be giving a thorough cleaning. They'll also be checking for any areas of infection or decay. For some cases, if we have a patient that's really struggling to keep their teeth clean, we'll recommend that they get cleanings more often. So maybe in braces, they'll go every 3 to 4 months instead of every 6 months.
Makes sense. What's an interdental brush? How is that used for braces?
So an interdental brush, it's also called a proxy brush. We call it a Christmas tree brush because it kind of looks like a little Christmas tree that's attached to a holder. it's helpful to use to get behind the wire and also between your gum and the braces. So it's really just an extra tool that you can use if you feel like there's an area that you're not quite reaching with your toothbrush, or let's say you're out and you don't have your travel toothbrush with you, you can use that just to clean around the wire and the braces.
I see. So what if you have bad breath while wearing braces? How can you address that?
So bad breath can be caused by a multitude of factors, but if you do have a lot of plaque accumulation and infections in your gums, that can definitely contribute to a bad breath. So by keeping your teeth very clean, that can definitely help to resolve that if it's caused by the bacteria or infections in the mouth. Sometimes bad breath, though, can be caused by other things like a postnasal drip or a stomach issue. So if it's that case, if we see that the teeth are really clean but there's still an issue with the bad breath, then we usually recommend that they consult with their primary care physician to see if there's anything else that's causing it.
Okay. Well, what if a wire or bracket becomes loose? What do you do?
The most important thing is not to panic. That can happen sometimes when you have braces on. Sometimes it's from eating something you're not supposed to, or sometimes it's just from something random. So the first thing you want to do is just notify the office that you have a loose bracket or wire. We will definitely let you know if it's something that you should be seen for immediately, or if you can wait till your next visit. And there's also things that you can do at home if it's uncomfortable. So if a wire is poking you, you can actually cut off the segment of wire with either nail clippers or cuticle pliers. Or if you have a loose bracket, you can also use wax, which we give you when you get your braces. You just take a small piece of wax and you kind of mold it to the bracket or the area that's poking, which will keep it more comfortable until the next time we're able to see you.
Are there any special considerations for nighttime care with braces?
Brushing and flossing is pretty much the same, but you just want to keep in mind that it's very important to clean out any buildup that has occurred during the day. So that's why we recommend if you're flossing once a day, it should be at least before bedtime. And you want to be very careful to remove any plaque or food buildup in your mouth, because when you're sleeping at night and you don't have that constant exchange of saliva over your teeth, it's more likely for cavities or infections to form if that buildup is sitting there overnight.
Gotcha. What about tooth sensitivity when you have braces? How can that be managed?
So, if in terms of sensitivity, if you're feeling soreness or pain on the teeth, some of that is normal when you're moving teeth orthodontically. It usually happens following an adjustment. It can last up to a couple of days. And if it's bothering you, then we usually recommend taking whatever you take for headaches. So either Tylenol, Motrin, something along those lines. But sensitivity that you feel like with eating something cold, there is, if it's a very quick sensitivity, like a little zing, one of the things that can help manage that is there are certain toothpastes that are made for sensitive teeth. One of the most popular ones is called Sensodyne. So that can actually dull that zing feeling that you get when you're having something cold. However, if you're eating something cold or hot and you're having a throbbing pain that lasts a while afterwards, you definitely want to notify your general dentist because it could be a sign of an infection inside the tooth.
Are there any common mistakes people make when cleaning their braces?
Really, the most common mistakes are not brushing for long enough, not angling the toothbrush properly, and not flossing daily. Those are really just the main things that can create an issue when cleaning your braces.
All right. So, overall, how does oral hygiene affect the success of orthodontic treatment?
Oral hygiene has a really great effect on not only the amount of time that you're in braces, but it can also affect the outcomes and the general success of treatment. If you're not keeping your teeth properly clean, your gums can become inflamed and puffy, and that can affect sometimes the speed of tooth movement. It can also, when your gums are puffy, it can make it even then harder to clean around it because the food can get stuck up underneath the gums. Another way it can affect is if you constantly have a lot of plaque and bacteria in your mouth, then you're creating an acidic environment, which has been shown to wear down the bracket glue. So braces are more likely to break in that instance. Also, when we're looking at the final result, we're going to make sure that your teeth are positioned properly, your bite looks great. But if you have formed these white spots and have puffy gums at the end, then the final result is not going to be as aesthetic as it could be.
Well, Dr. Khedkar, thanks again for teaching us about orthodontics. This was a really informative episode, and we're looking forward to seeing you again.
Thank you.